now male reproductive organs. Let us discuss about the male reproductive organs. First, let us name what are all those organs which are related with the reproduction. These are basically divided into two groups. One is the external genital organs. These are also divided into internal genital organs. The external and internal genital organs. The external genital organs are those which are present outside the body. What are they? In males, it is penis, which is the male copulatory organ. Penis, which is the male copulatory organ. Then we have got the testis. Please understand, ES is plural. Okay. Now if you write testis, this is singular. That is, males have got a pair of testes. Right testicle, left testicle, or right testis and left testis. So when it is right testis, IS. When it is right and left testis, then this is ES. Okay, that is the plural. Then these are present. The testicles are present in the scrotum sac. In the right half of the scrotum, we have got the right testis, and the left half of the scrotum, we have got the left testis. So you have got the scrotum. Scrotum or the scrotal sac. Yes, scrotal sac with the right and left halves lodging the respective testicles. Then we have got the epididymis, and we have got the spermatic cord. In fact, you can tell a portion of vas deferens that is present in the spermatic cord. You can tell vas deferens or ductus deferens. Okay, vas deferens or the ductus deferens that is present in the spermatic cord. You understanding? So these are the external genital organs, starting from penis, which is the male copulatory organ, and then the testis present in the scrotal sac, epididymis, and the terminal part or the ending part of the spermatic cord, and a portion of vas deferens which is present in the spermatic cord. We have made a separate class on spermatic cord. You can see it, the contents and the coverings of the spermatic cord. Then coming to the internal organs. What are the internal male reproductive organs or internal male genitalia? So they are prostate gland, the prostate gland, then we have ejaculatory ducts, seminal vesicles, and then vas deferens, a major portion of the vas deferens. So vas deferens, some portion, a little portion of it is present outside the body, but major portion is present inside the body. Okay, vas deferens is also called as the ductus deferens. So both mean same, vas deferens and ductus deferens. Okay, now what are the male internal genital organs? Prostate gland, ejaculatory ducts, seminal vesicles, and vas deferens. And why is testis present outside the body? This is present outside the body because for production of sperms, which you call spermatogenesis, the temperature should be less than 3 degrees compared to your body temperature. The temperature for the production of sperms should be at a lower level. So 3 degrees minus your body temperature will be the 3 degrees minus the body temperature will be the temperature in the scrotum. And please understand, the arterial blood which reaches the testis, that is also cool. You understanding? Generally when we talk about the arteries, the blood in the arteries is warm. Okay, but the testicular artery takes or it nourishes the testicles by giving blood which is cold, because around one testicular artery you have got a plexus of veins called pampiniform plexus of veins. So they steal the temperature. The warmth of the testicular blood is stolen by the venous blood that is present around the testicular artery in pampiniform plexus of veins. Thank you. Spleen, the applied anatomy of spleen we are going to discuss. You know, normally spleen is not palpable. In a healthy individual, we cannot palpate the spleen. But in cases of splenomegaly, so what is splenomegaly? Enlargement of spleen is called splenomegaly. So during this condition called splenomegaly, yes, we can palpate the spleen. When we are palpating the spleen, we ask the person, that is the patient, is going to lie towards his right lateral side, and then we can palpate the clinical angle of the spleen. Very nicely you can palpate. The spleen must be enlarged twice its original size. Then only we can palpate the spleen. That is, once it becomes double in its size, then only we can palpate. And which part of the spleen are we really palpating? You know, in gross anatomy we have learned that the axis of the spleen is, along the long axis of the 10th rib. It is directed downwards, forwards and lateral. Downwards, forwards and lateral. Now just look at the diagram. Here we have got the posterior end of the spleen. Okay, here we have got the anterior end. This is the superior border which is showing the notches. So here we are having the notches. So what is it showing? It is showing that it is the superior border, and here we have got the anterior end, which is also called as lateral end of the spleen. So this portion is called the clinical angle of the spleen. Here what you are seeing is what you are palpating once there is splenomegaly. So this is called the clinical angle of the spleen. Clinical angle of the spleen. Are you understanding? And we can also palpate the notches which are lying along the superior border. Okay. So here you see this is the posterior end of the spleen. Now what are the conditions where there is splenomegaly? So splenomegaly is in different conditions. For example, in infections like malaria, very common, malaria presents with splenomegaly, or there is splenomegaly during malaria. Also in case of disorders of the RBCs like thalassemia, hereditary spherocytosis or sickle cell anemias. So here there is a problem with the blood cells. So that time they are going to cause thalassemia, like conditions like thalassemia, hereditary spherocytosis and sickle cell anemia. In these conditions the spleen is again enlarged, and that is called splenomegaly. Also in conditions of Hodgkin's lymphoma, non-Hodgkin's lymphoma, also there is splenomegaly. In conditions like cirrhosis of the liver in case of chronic alcoholics, or conditions where there is increased portal hypertension or portal vein when it is blocked, or the splenic vein when it is obstructed, when there is portal venous obstruction or splenic vein obstruction which leads to the cirrhosis of the liver. In all these conditions there is enlargement of the spleen, and that we call it as the splenomegaly. Are you able to follow the splenomegaly? Then also when we are talking about the spleen, we should be careful about the splenic rupture. The splenic rupture is common when there is fracture of 9th, 10th, 11th ribs. The splenic rupture. On the left side we have got the spleen, the left hypochondrium, we have the spleen present. So if there is any accident, imagine there is a person who is driving the two-wheeler and then a lorry or a four-wheeler is coming and hitting his left thorax, his left chest. Then what happens? The 9th, 10th, 11th ribs, once they are broken, these broken ribs, they can pierce into the spleen and cause splenic rupture. The patient is presenting with shock because of internal hemorrhage. Then you have to take up this case as an emergency and go for splenectomy. What is splenectomy? We have learned splenectomy. Tommy means cutting off, right? So this word Tommy, this is in respect to the anatomist, splenectomy. The spleen is cut and removed. So this we are doing because we want to save the person. We want to prevent the hemorrhage. We learned that the spleen is supplied by splenic artery, which is the largest branch of the celiac trunk, which is tortuous. And so once the spleen is ruptured, lots of internal bleeding is happening. Severe internal bleeding or hemorrhage is happening, and the patient is in a state of shock. So you do splenectomy. After doing splenectomy, some portions of the spleen you can suture in the greater omentum. You can suture in the greater omentum and they will survive the small grafts. You're understanding? And then imagine if there is a laceration or just a small tear in the region of spleen. A tear is seen. Okay? The capsule of the spleen is lacerated and tear is seen. Then with catgut you can suture. You need not go for splenectomy that time. So with catgut you will suture, and then a small piece of greater omentum you will wrap that suture site with. You are wrapping the tear. First you are suturing the tear with a catgut, and a small piece of greater omentum is kept there and wrapped up. Okay, to give support. Are you able to understand? And we can record the increased pressure in the portal vein via the splenic puncture. So you are using a lumbar puncture needle. It's called splenic puncture. So what you do, you ask the person to hold his breath when you are introducing the needle in the region of left 9th or 10th intercostal space. You take a lumbar puncture needle and you will introduce it via the mid-axillary line in the region of 9th or 10th left intercostal space. Okay, and you will ask the person not to breathe. He will hold his breath that time. When the patient is holding his breath via the mid-axillary line, you will introduce the lumbar puncture needle into the spleen so that there is no laceration of the spleen. If the person is breathing, then the needle will move up and down. So the person should hold his breath, and then you are going to do the splenic puncture, and with this you can also record the pressure that is present in the portal vein. Okay? And inflammation of spleen is called splenitis.